My name is Sarita Richards. I am the current MDA National and RDAA Indigenous Health Bursary recipient. I'm studying medicine at Flinders University as part of the Northern Territory Medical Program. My family are from the Torres Strait Islands and from Cape York, and I also have an English-Irish heritage, and I have grown up most of my life on Larrakia land in Darwin. So today is Closing the Gap Day, and I think it's a really good opportunity to reflect on past and present practices, think about what things have worked, what things have not worked, and try and build a better future for my people. When it comes to closing the gap, we know that things haven't been effective, and I think that's really important to admit that despite some good efforts, a lot of the gaps have not been closed, some have widened, and we need more guidance for people on the ground who have committed a lot of their time, some people their life, to improving outcomes for First Nations people. And that guidance needs to come from the top, and it needs to be a collaborative effort. One of the things that could contribute to that would be having a First Nations voice in Parliament, someone to stand beside and be one of the leaders to help people recognise that these issues are real, they're present and they're continuing. We need a joint effort from all different services and all different contributors from the health system, education, justice. We need to be talking about past trauma and how that has affected multiple generations, so that we can address those, help people to realise them, including First Nations people, because some people don't understand the effects of past traumas on their current life and on their children and their children's children. It's quite confronting working at the moment in community up in East Arnhem Land, that you see the disparities that still exist. But I think it's really important that we focus on trying to improve things, and there's always hope that that will happen. When you see and speak to people who are making a difference, whether they're First Nations backgrounds or not, gives a lot of people hope. And I think with further guidance, these goals can really be achieved. So on National Closing the Gap Day, I feel really proud and grateful that I have the opportunity to be here, to be studying medicine, to be able to hopefully make a small difference in some people's lives, especially other First Nations people. I also hope that I can inspire other First Nations and other young people, especially from rural and remote places, to be able to work hard to achieve their goals, to be able to stand beside and work along with other people to try and continue to bring the health of our people up. I'd like to thank MDA National and RDAA for this opportunity and for their ongoing support in my studies. It's a great opportunity this week to be able to mingle with other doctors, especially doctors working in rural and remote locations, who are out there trying to make a difference and trying to help First Nations people and other rural and remote Australians. And also for the opportunity to be able to network with people who have the powers to make decisions that are going to affect us for a long time in the future, and hopefully learn something, and yeah, a good networking space.